So there's a lot of suggestions. There are other more holistic ways to manage LDL cholesterol, and and some are even saying like garlic pills, right? Apple cider vinegar. I've heard of a lot of them, but at the end of the day, I mean, from an endorsement perspective and medical guidelines, when a patient presents with or have high risk for heart disease, we're going by certain guidelines, and statin therapy is one of them. So, something like that one can suggest only if it's monitored. So you start it, and then every 3 months we're checking your LDL cholesterol, and you should be able then to see how it's trending. Again, remember, LDL cholesterol your body produces. It's not so much coming from dietary intake like triglycerides are.
What is a biometric test?
So there are certain laboratory medicines that can evaluate what your biological genetic risk factors may be, because there's something called cardiac risk score. And so we can do, and there are some genetic factors that can predispose to many different conditions. So when we do biometric testing on you and on your blood, we're looking at certain types of factors that may predispose you to certain types of conditions, and what your risk factor may or may not be based on the outcome of the blood test results. The problem with biometrics is, unfortunately, it's very good science, but it's not really recognized yet and paid for by Medicare, which basically, decides what they're going to recognize. And sometimes, Medicare's gotten much better over the years, but they are a little bit sometimes behind the latest, greatest things coming out of Cleveland Clinic and UCLA and things like that. But if you could do it, the other thing about biometrics is that sometimes it tells us about a problem that we can't even alter, right? Like Alzheimer's disease, right? And so, it might be good to know about it, but sometimes it's not modifiable.
Why would our insurance company want us to take that test?
Are you talking health insurance, or are you talking life
Health
insurance?
insurance.
So, one, pound of prevention is better than a ton of treatment. So if they can find something that's early preventable, then they can do an interaction and bring a call to action to neutralize the risk factor. That's one of them, because again, the idea is, if it ain't broke, don't fix it, is a broken philosophy in our healthcare system. And so disease usually starts 5 years before the first symptom. So this is about early intervention through early detection, if there is an intervention available. And there is in some cases, and there isn't in other cases. But at least if there isn't, families and patients can kind of take necessary steps to make a bad situation less bad. Yes, sir.
Vitamins to help you to keep your cholesterol and things right?
So the problem with vitamins is I've seen where too much of a good thing isn't good for you either. And so some people really overdo it, and certain vitamins in high levels, like vitamin A, can cause toxicity to the liver. So I honestly think the best thing is just one good multivitamin. Like what I would do is I would take a multivitamin, and they have one for men and women, right? Like Centrum Silver for men, Centrum Silver for women. Omega-3 with CoQ10, very good, okay? And those are, and then vitamin D supplementation, because 80% of us have low vitamin D. Vitamin D comes from sunlight. Vitamin D is not only important for strong bones, it's actually been associated with risks for heart disease too. And they think why? Because people who have high vitamin D, they're obviously outside in the sunlight, meaning they're super active. Active bodies are healthier bodies. Sedentary bodies, bodies indoors, are not getting vitamin D, and then they have low vitamin D levels, and that's maybe where we see the risk of heart disease. So vitamin D, omega-3 with CoQ10, and a multivitamin, that's what we should be taking. And let's not consider those medications or drugs or pills. Those are just holistic therapy. Yes?
What's on the horizon in terms of medical breakthroughs that you can get excited about?
Well, I think right now there's great medications out there that were not available to improve quality of life and to maintain and control disease state, like I mentioned, the Entresto and the Eliquis. Why? Because less burdensome. You don't have to get blood works all the time, in that sense. I think too, when we look at things like diabetes and prediabetes and obesity, You know, there's a lot of great medications out there right now to help reverse obesity and control obesity and improve, you know, the risk factors. Because you know when you have diabetes, you have a 3 times greater risk for heart attack and stroke. And so medications now that treat type 2 diabetes, some of them have FDA, Federal Drug Administration approval for reducing the risk of heart disease. So you're killing 2 birds with 1 stone, you know? So I think right now, medications and pharmacology has come a long way in every platform, from cancer to heart disease to diabetes, okay? Which, you know, we didn't have even 10 years ago. And the idea that prevention, you know, is the best cure, I think knowledge right now and just being an informed consumer, you know, you're not a patient, you're a consumer. And, you know, you need to go in with facts, and you need to at least, you know, maybe you only have 10 minutes with your doctor, but make the most of those 10 minutes, and then have another 10-minute session in 6 to 8 weeks, and then another 10-minute session in 6 to 8 weeks. And have like a plan where you kind of like almost like a book with the chapters. Chapter 1, I'm gonna do heart disease this month, I'm gonna do fall prevention next time, I'm gonna do vaccines, cancer screenings, and, you know, just come with understanding that you wanna have a dialogue, not a monologue.
Yes, that's what I mean.
What's up with the potassium supplement? Costco no longer sells them, potassium. Is there-
So, because you know those potassium pills are big, right? Some of them, and they can get caught in the esophagus and cause quite iron pills too, right? And they can irritate the heck out of you. And then you have so many potassium-rich foods. I mean, you know, like my nutritionist said, you know, when we go food shopping, we should only use aisles 1 and 2, and then skip all the rest of the aisles, right? Because what's aisle 1 and 2 in the supermarket? It's vegetables and meat and fish. And then everything else is canned and boxed. But, you know, I mean, we created it, so we're now dealing with it.
Tell the truth.
Could you also mention about the fact that gum disease can also cause heart problems and affect your diabetes?
Yeah, so gum, you know, the human mouth, despite how well we try to wash it and clean it, is full of germs. And, you know, if you lift up your tongue, you'll see all those veins underneath your tongue in circulation. Well, where do you think the mouth drains directly to? The heart, because here's the mouth and here's the heart. So there used to be a condition very prevalent in the old days because we had far worse teeth conditions back then than we do now. You know, dentistry has come a long way, but endocarditis. Endocarditis is a very bad infection of the heart, and in the old days, you know, when you know, in the 50s and 60s, endocarditis came from dental caries. Nowadays, endocarditis is coming from IV drug use. But, so to answer your point, you know, it's very important to have good hygiene orally with the teeth and the gums and flossing and all that because of just the proximity and how the body drains and works. I mean, yes.
Medication is helping us high. I'm nervous. Like, blood temper, check myself every night. The insurance company said that it will go up to $2,500 a month. The insurance company paid $1,600. So I asked them, well, who's gonna pay the other $900? It's me. That's for 30 days. Why is this going up so much?
So that's a huge conversation, because, and a lot has to do with the patents and what pharmaceutical companies are spending to get a drug to come from the laboratory safely to the consumer, and then how many years they're allowed to have exclusivity to that medication. And, but one of the things I will say about pharmaceutical companies is they have very good patient assistance programs. Have you like called them and filled out a form? Because basically, you know, it is paperwork, but if you demonstrate that you're on a fixed income and that your income just takes you to where it needs to go, and there's very little margin, you can get assistance and they will, you know, give you the medications at free, you know? And I've seen that for many brand name medications that we've done for our patients. So, but yes, it's more red tape, it is more hassle. Healthcare, believe me, healthcare is not a convenience. And healthcare is not easy to navigate. You know, so it definitely, the system is far from fixed, and there are a lot of different reasons for that. But at the end of the day, you know, we're the architects of what we build and destroy, you know? Yes.
Yes, could you talk, give us some information about pericarditis? I had a very bad case of that in 2003, that had 3 hospitalizations. And for some strange reason, the first 2, they didn't know what was wrong with me. So I went through so many different tests, was in the hospital for days. And then, when I came out, I went back to work maybe for a week, and it came back. Finally, I was diagnosed with pericarditis. So they treated me with a lot of Motrin,
Yeah.
then ibuprofen, and then also a gout medication to go along with that.
Indomethacin.
But as years went by, a couple of times I could feel the symptoms coming back. And I want to know, why is it so hard to detect? And is it something from a dietary point of view that I can do to stay on top of it?
So pericarditis is basically an inflammation. Itis means inflammation, right? Like diverticulitis, pericarditis, itis, inflammation. Pericardium is the name of the sac. Your heart's in a sac. Like imagine like a little, I don't know, saran wrap around your heart, and that saran wrap becomes inflamed. And it can sometimes become so inflamed that it causes fluid to build up around your heart. And some people actually need to get cardiac windows where they make a hole to drain this fluid out. Pericarditis, there are many different causes for pericarditis. Sometimes it's associated with cardiac procedures and heart attacks, sometimes, you know. Sometimes it's also associated with autoimmune conditions like lupus. Sometimes it's associated with in dialysis due to inadequate dialysis. So it's an inflammation of the sac around the heart that is treated with NSAIDs. That's exactly what you said. And gout, what's gout? Gout's an inflammation, and we give anti-inflammatory medicine to take it down. Pericarditis can happen, and happen again and again. Sometimes we can find a source, sometimes we can't, because there's so many different causes for it, you know. But, you know, if there is no, for example, recent cardiac catheterization or a heart attack or any type of cardiac intervention, the next thing you want to look at is autoimmune, you know, autoimmune where the body attacks itself. Lupus, rheumatoid arthritis are classic examples of autoimmune conditions. It's a painful condition because it causes pain, severe pain. Taking a deep breath is next to impossible. You can't find how to sit down, lie down, or whatever. But it's not, historically, it's not a dangerous condition as much as it is an annoying condition. And as you saw with the NSAIDs for a period of time, you know, you will reduce the inflammation, because that's what it is. Itis is inflammation.
Taking Advil, because it was suggested if I start feeling it coming back, is to take 2 Advils, and I did that, and it did seem to help, but I don't know.
So I'm not a big fan of Advil, Motrin, or ibuprofen in the elderly, because your stomach gets older, and the stomach lining gets older, and then you could really increase your risk for gastritis and peptic ulcers. The other thing about NSAIDs is it's a very, very common cause of acute kidney injury, too, of taking NSAIDs. That's why they always recommend Tylenol in the elderly, you know, because Tylenol goes through the liver. But it won't help so much for pericarditis. And the problem is you have more here than just your heart that can cause chest pain. You also have ribs, you have cartilage, you have chest wall muscle. You also have your esophagus, which is a muscle that runs right behind your heart from your mouth to your stomach. And that can get a Charlie horse, no different than a Charlie horse in your legs, and you know how that feels. So you may want to, you know, rethink, because pericarditis, I mean, and it's easy again to diagnose. We do an echo and we see the inflammation around the heart, and there's some blood tests too that can suggest it. So I think before you, you know, automatically assume every pain in the chest region is pericarditis, I think you shouldn't assume it that way. I mean, I know it's, you know, there's that, you know, recall that you're experiencing. But I would go with 2 Tylenol first, you know, and go that route, because the likelihood of it being pericarditis again is less on the top 10 list. Okay.
Thank you.
Yes.
Can you speak about anti-inflammatory foods?
So antioxidant foods.
No, anti-inflammatory foods.
Well, I like to call them more like antioxidant foods, because antioxidants is anti-inflammatory. And there are many food groups out there that have antioxidant effects. That's why that Mediterranean diet is so big right now. And, you know, like, nutrition, it could be a whole topic in itself. I mean, and not just for discussion, but as a career, because nutrition is something we take, you know, for granted. I want to try to make things just easier for everyone to be able to manage and do. So when I think of, you know, antioxidants, I'm thinking just, again, fresh foods, fresh preparation, okay? I'm thinking of lots of, you know, combination of portions of vegetables and lean meat, the olive oil, as we talked about, okay? You know, flaxseed from, you know, pecans, almonds, walnuts are very beneficial as an antioxidant goes. Potassium-rich foods, lycopene. Lycopene we see in watermelon and tomatoes, tremendous antioxidant benefits, you know? So, I mean, in this library, I'm sure there's a, you know, where you can just get a simple, you know, maybe ridiculously simple guide to proper shopping and proper eating, you know? Because what you put in your body counts.